Good evening, everybody, and welcome to the ACHS Virtual Awards Ceremony 2020. My name is Dr. Karen Luxford, and I'm the CEO of ACHS and ACHS International. I'd like to acknowledge the traditional owners of the land and the country on which we meet, as you are all across the country in different locations. This is the first time we've held a virtual awards ceremony. And tonight we're celebrating the announcement of the Quality Improvement Awards 2020 and the ACHS medal winner for 2020, as well as launching this year's edition of the Australasian Clinical Indicator Report. And we have a very special guest speaker for you. While we're unable to hold this event face-to-face this year, we trust that you will enjoy this new format and congratulate the winners as we announce them this evening. I also wish to acknowledge the panels of judges for our Quality Improvement Awards who have generously given their time to evaluate and judge the many entries that we received this year. Our colleagues, and most importantly, the many varied people working in healthcare today who've provided such strong contributions this year towards the improvement of quality and safety. Our ACHS assessors, who work hard to assess healthcare services against the safety and quality standards. And I'd also like to acknowledge our amazing ACHS staff team who have risen to the challenges of 2020 and introduced new innovations to ensure that we keep evolving. Welcome to everyone who's joining us around Australia and overseas. If you're tweeting tonight, please use the hashtag ACHSAccred. It now gives me great pleasure to extend a warm welcome to Professor Len Notaras, AM, President of ACHS Board of Directors.
Thank you, Karen, and good evening to everybody. My name's Len Notaras, and as the President of the Australian Council of Healthcare Standards, ACHS, it gives me great pleasure to formally welcome you to our ACHS Virtual Awards 2020 event. On behalf of my fellow councillors, I'm delighted that you've taken the time to join us this evening to celebrate some of our achievements over the last year. It's been an extraordinary year for all of us, particularly for everybody working in the healthcare industry, and we've had to face and conquer some extraordinary challenges while still achieving our ordinary everyday business. I think this makes this evening an even more special evening, that we've come together to celebrate our successes as well as the achievements of others with the 2020 Quality Initiative Awards and the ACHS Medal. One of my great pleasures this evening is to formally launch the Australian Clinical Indicator Report 2012-2019, 21st edition, otherwise known as ACHS. We've now been collecting valuable clinical information data for 31 years and are proud to have the longest standing collection of such data in the world. This is quite simply one of our greatest assets, which continues to build on the status of ACHS's reputation and purpose year on year. The most statistically detailed report of its kind and assisting greatly in providing our credentials as authoritative healthcare accreditation providers. I'm therefore delighted to launch this ACHS report this evening, which will be available on our website from tonight. That's at www.achs.org.au. I'll now hand back to Karen, who'll present the Quality Improvement Awards. Thank you, Karen.
Thank you, Len. There's a lot of anticipation about the announcement this year as we received a record number of entries. It gives me great pleasure to announce this year's winners. But before I do, I'd like to acknowledge again the superb efforts of the panels of judges who have made these final decisions. Thank you for your magnificent work. This year, ACHS celebrates the 23rd anniversary of the Quality Initiatives Awards. This is a very popular program with healthcare organisations across Australia and internationally. The awards program recognises and encourages outstanding quality improvement activities, programs or strategies that are implemented in healthcare organisations. The awards are presented in 3 categories. Firstly, clinical excellence and patient safety. Secondly, non-clinical service delivery. And thirdly, healthcare measurement. And for the second year, ACHS will also be awarding the Global Quality Improvement Award, which is selected from the existing 3 categories and recognises organisations using Australian healthcare standards to strengthen quality improvement frameworks internationally. Firstly, we will list the highly commended recommendations and then announce the winning organisation. The highly commended certificate was awarded in the Clinical Excellence and Patient Safety category to the following organisations. The winner of the ACHS Clinical Excellence and Patient Safety Award is the Victorian Institute of Forensic Mental Health, Forensicare, Victoria.
Thank you so much, Karen. On behalf of Thomas Embling Hospital, the Centre for Forensic Behavioural Science and Forensicare, we are absolutely delighted to accept this prestigious award. There are a few people we would really like to thank. Firstly, we would like to acknowledge the Australian Council of Healthcare Standards for their commitment to quality improvement and evidence-based practice in healthcare.
Thank you to all of the people involved in the project, Dr. Jessica Griffith, Professor Michael DeFern, Distinguished Professor Jim Ogloff, Professor Brian McKenna and Chris Guest. Thank you also to Associate Professor Stuart Lee for assisting with the application. We would also like to acknowledge Lindy Bennett, our Quality and Risk Manager, for her contribution to the service in the work she does and her support for this project.
This project has been underpinned by effective multidisciplinary collaboration between the clinical setting, Thomas Embling Hospital, and the research arm, the Centre for Forensic Behavioural Science, and a strong desire to improve safety for all. Thank you to our CEO, Dr. Margaret Grigg, for her ongoing support, commitment and leadership, not only for this project, but in her focus on positive outcomes for consumers across our service.
Lastly, we'd like to thank the consumers and staff at Thomas Embling Hospital for their willingness to be involved in innovative projects and their commitment to quality improvement.
Our project involved enhancing the dynamic appraisal of situational aggression, the DASA, a risk assessment instrument developed by Professors Ogloff and DeFern, designed to assess the risk of imminent aggression. We undertook work to identify suitable nursing interventions to correspond with the DASA risk assessment levels, prioritising the use of the least restrictive interventions called the Aggression Prevention Protocol. Chris Guest, our Information and Communications Technology Strategic Manager, then developed an electronic system that integrated the eDASA and the APP into the electronic medical record system. After piloting the eDASA and the APP on the female acute unit, a randomised controlled trial was conducted on the 2 male acute units. The results from both studies have demonstrated a reduction in aggression, that's all types of aggression, reduction in the use of PRE medication, a reduction in the use of restrictive interventions, restraint and seclusion, and an increase in diffusing techniques and documentation. So, thank you.
Thank you.
A highly commended certificate was awarded in the non-clinical service delivery category to the following organisations. A special commendation certificate was awarded in the non-clinical service delivery category as an initiative to advance Aboriginal and Torres Strait Islander healthcare outcomes goes to the Child and Adolescent Health Service in Western Australia. And the winner of the ACHS Non-Clinical Service Delivery Award is Redcliffe Hospital, Queensland.
Oh, well done. That's brilliant. Thank you. Well, thank you very much, ACHS. It's such an honour to receive this award. It was a real thrill to receive it. We put our submission in because our idea that we implemented, which was born out of necessity when the COVID sort of problem started, it worked so well, and our whole team really got behind it and made it a success, from our pharmacists, our admin staff, other people in the hospital, like the pre-admission clinics and things like that. It was such a great thing, and the feedback we received was really great. So yeah, it was wonderful, and it's been a great thing. So I might hand over to Jeff Creamer, our director, just to explain where the idea came from, because it was really his idea, and he can do that now. Thanks.
Thanks, Michael, and thank you very much to the ACHS. We are so stoked to be receiving this award, and very proud of my team here at Redcliffe Hospital. So as Michael alluded to, the drive-through came out of necessity. We needed to ensure that our patients were getting the right medication at the right time. And at that particular time, or during COVID, there was a lot of restrictions that were put in place with visitors coming into the hospital, which meant a lot of outpatients. It was a challenge for them, with the sign-in process, with the concierge, etc., to actually get their scripts, and it added time to their busy days. So we needed to come up with very rapid solutions, redesign how we did things to ensure that patient safety was paramount and that they were receiving their medications appropriately. And during that redesign process, we ensured that there was really robust processes around counselling and clinical handover to ensure that patients were getting equal counselling, if not better counselling, with utilisation of telehealth and also telephones, to ensure that they understood how to take their medications. And it raised some good learnings in the respect that patients were asking questions that they probably never would have asked when they were in a busy waiting room. More private questions, which made them understand their medications a lot better. So we are really stoked, and I'm really happy with how the drive-through is functioning, how it's working, and also the patient experience and safety components of it as well. I would like to thank our organisation for the support that they've provided us in supporting the drive-through, and the ongoing support with it as well. So thank you very much, and I'm very honoured to receive this award. But I'll just pass over to Anne as well to talk a little bit about those patient experience measures that I was talking about.
Thanks, Jeff. Yeah, so we captured our patient experiences through surveys throughout the process, and the results coming through those surveys are overwhelmingly positive, arguably the best that you could receive in a patient satisfaction survey, which was so heartwarming. So particularly our patients liked being able to stay in the privacy of their car while one of our team members came out to take their medications to them. And that was particularly nice because they didn't need to come into the waiting room, the pharmacy waiting room, which sometimes are not the most pleasant of places, unfortunately, particularly because you don't know who else is in that waiting room with you. It also meant that they didn't need to battle out for car parks, and we know that hospital car parks across Australia can be challenging at the best of times. Looking at our waiting times, most patients only waited for about 2 minutes for their medications to be delivered, as opposed to sitting in the waiting room for up to an hour at our peak times. In terms of our staff's perspective, being able to book in patients allowed that scheduling and the separation and prioritisation of workload, which we found particularly helpful when we were planning for contingencies around COVID and the workforce shortages that we were anticipating. So yes, again, thank you very much, ACHS. We're very, very excited to be receiving this award.
Thank you very much. Thank you.
A highly commended certificate was awarded in the healthcare measurement category to the following organisations. A special commendation certificate was awarded in the healthcare measurement category as an initiative to advance Aboriginal and Torres Strait Islander healthcare outcomes goes to Hunter New England Local Health District, New South Wales. The winner of the ACHS Healthcare Measurement Award is Metro North Hospital and Health Service, Queensland.
Thank you. It's absolutely amazing to receive this award. We are thrilled and pleased to be able to receive it. It's the culmination of a huge amount of work from 22,000 staff across 5 hospitals and a community service. When we first announced that we would like to address hospital-acquired complications to our staff, we got instant engagement. And the entire service focused on improving outcomes for patients. And so in each of the 16 categories of hospital-acquired complications, we had a significant improvement, up to 77% in some of them. And so we dropped our hospital-acquired complications from 10,000 to 6,500 in 1 year. That's huge benefit for our patients. And we've had so much fun as a health service doing it. So for all of those who did the literature searches, who did the built the dashboards so we could monitor our progress in as quickly as we could, to those who changed policies and procedures, worked out new flows, thank you to all of them. And this is an acknowledgement of the fantastic work of so many people. We know that sometimes we're always looking to the future. One of my heroes is Marie Curie, and she said, "One never sees what has been done, one only sees what remains to be done." And I think on a night like this, at the ACHS Quality Improvement Awards, she would permit us a moment of modesty as we look back and celebrate the fantastic work that happens. Every year we see the quality of the nominations, and so to be awarded that for our Metro North, I'm particularly thrilled, pleased and proud to be a member of that service. And as sensational as receiving this award is for the staff and the Metro North Health Service, I have to say something on behalf of the patients. A patient with a hospital-acquired complication has an average length of stay of 15 days. And without a hospital-acquired complication, that shrinks to 3 days. So any work we do in this space is an absolute bonus for the patients who are the beneficiaries of that improved service. And to be able to use healthcare data to make that change in the lives of the people we care for is absolutely sensational. And thank you to all involved, and it's fantastic for this award. Thank you.
A highly commended certificate was awarded in the Global Quality Improvement category to the following organisations. And the winner of the Global Quality Improvement Award is Hong Kong University Shenzhen Hospital, China.
Thank you so much. The whole hospital is so thrilled and honored to receive this award. May I introduce that Hong Kong U Shenzhen Hospital is actually a very young hospital. We are only 8 years old. So starting from University of Hong Kong, this is an affiliated hospital in China, for which we want to introduce reforms so that we can all together make improvements. Now, and here we learn a lot of things. Carding is one important aspect. So that's why, and actually in China, they have different centers and they have different credentialing. So we have to improve ourselves to make sure that we are the best center to serve the people in the city. And then we gain recognition that we reach the province requirement level and then the national level. So we have to make all these improvements. And we are actually, as I say, we're only 8 years old. And actually we are the first hospital in China who go through ACHS accreditation. And for this, we were very happy because we learned a lot from the quality improvement introduced by ACHS. And this is a very important step in our hospital reform. And through the years, then our team, various team, try to improve the chest pain center, which is doing for the ST elevation myocardial infarction team is one big one. And then there are others like stroke center and so on. But I'm very happy, exceedingly happy, and then congratulate the team headed by Professor Yu and Dr. Wu. They are the one who make this dream possible. So I'll hand over to Professor Yu to say how we improve from 118 minutes back in 2018 to 83 minutes for the door-to-wire time in 2019. And we are still trying to improve further. So I'll hand over to Professor Yu to tell us more.
Thank you, Professor Andy, for the kind introduction and receiving the award on behalf of our team. So as we know, between 1990 to 2018, the absolute number of cardiovascular deaths increased by over 50% in mainland China, perhaps due to the aging population and also accumulating of overall cardiovascular risk factors such as higher cholesterol, a greater number of smokers, etc. So therefore, the economic consequences of cardiovascular disease is enormous in China, and it translates into a very high direct healthcare cost and indirect loss of productivity due to the premature deaths and residual disability secondary to ST elevation MI. So as we mentioned, among all kind of heart problem, ST elevation MI is the highest risk of all. And the pathology of ST elevation MI is due to the acute blockage of the coronary artery, leading to myocardial infarction. So the opening of the vessel, which we call the revascularization of the vessel, is the gold standard of treatment. And by reducing the time of revascularization would obviously improve the outcome of the patient by reducing the myocardial damage. So the idea of reduction to the door-to-wire time is to reduce the time of blockage of the vessel. So we try to open up the vessel as soon as possible. The success of this program includes a very supportive leadership from the hospital, led by Professor Andy and Professor CM Low, our hospital chief executive, a very dedicated team of staff to perform the procedure, the operation, without any compensation or complaint to the hospital or to the team. And finally, we have unfailing efforts to try to find ways to further improve our programs. And hopefully, by this award, we could introduce our hospital to the ACHS as well as the National Chest Pain Center to the rest of the world in order to combat ST elevation myocardial infarction globally. Thank you very much.
All of the submissions are included in the Quality Initiatives publication, which can be viewed on our website. Thank you, everyone. And now I'm delighted to hand back to Professor Notaras to present the ACHS Medal for 2020.
Once again, thank you, Karen. Each year I have the greatest honour of presenting the ACHS Medal. Now in its 36th year, the award of the Gold Medal provides a valuable spotlight on recognising personal performance in health, quality and safety arena. It continues to recognise an individual's outstanding contribution to the promotion of quality and safety in Australia's health services. The award is ACHS's highest award, and tonight I can announce that the 2020 recipient of the ACHS Medal is someone that many of you will be very familiar with through the events surrounding the unfolding coronavirus-19 pandemic in Australia. The 2020 recipient is none other than Professor Brendan Murphy, formerly Australia's Chief Medical Officer and now Secretary of the Department of Health in Canberra. Our heartfelt congratulations, Brendan, on this award, and I'll now read the citation that accompanies the medal. Professor Brendan Murphy has worked for 40 years in the Australian healthcare system as a doctor, a medical researcher, a senior executive and a mentor. He has held a range of board positions, including at the Florey Institute, the Olivia Newton-John Cancer Research Institute, and the Victorian Comprehensive Cancer Centre. Professor Murphy has recently commenced his position as the Secretary of the Federal Department of Health, the first medical doctor to serve in this particular role. Prior to his appointment, Professor Murphy was the Chief Medical Officer for the Australian Government from 2016 and was the Principal Medical Advisor to the Federal Minister for Health. He also held direct responsibility for Health Office for Health Protection and for the Health Workforce Divisions. In addition to many committees that he chairs, co-chairs and participates in, he is the Australian member on the International Agency for Research on Cancer, IARC, Governing Committee, and represents Australia at the World Health Assembly. When he first was appointed as Australia's primary medical advisor, Professor Murphy made an impression. He went beyond the traditional focus of the role on biosecurity, immunisation and disease surveillance, engaging with the health sector as a whole. Professor Murphy was at the forefront of the Australian government's response to the coronavirus pandemic as a key policy advisor and government spokesperson, and as the chair of the Australian Health Principal Protection Committee, AHPPC, the key body advising the National Cabinet through the coronavirus pandemic, which immediately followed Australia's Black Summer bushfires. Professor Murphy's distinguished leadership over many months as the Chief Medical Officer positioned Australia to be able to respond to COVID-19 in a coordinated manner based on evidence and ensuring that quality practices were implemented for the health of the Australian community. Brendan, it gives me great pleasure to award you the ACHS 2020 medal. And while we can't be together in person tonight to hand over the award, it is sent with our strongest best wishes, Brendan. Congratulations, Brendan. And as our special guest speaker this evening, we look forward to hearing from you, not only about your career, but also some of the highlights and experience in your most recent roles and your reflections on the pandemic, from its very start to where we are now.
Thank you so much, Len, for your kind words, and thank you so much to the ACHS board for affording me the deep honour of being awarded your medal this year. There is a proud tradition of the ACHS medal, and I know that I'm following a long line of distinguished recipients. I'm sorry that it is not a live event. I would have loved to have enjoyed your dinner and the company of the many people who normally attend such an event this year and each year. This is very different ACHS event, and of course it comes on the back of a very different year in healthcare in Australia, and indeed a very different year for every Australian. 2020 has been the year of the COVID pandemic, and it is a long way from being over. For a while, on the 2nd of November, Australia recorded its first day since the 9th of June with no community transmission. Much of the rest of the world is experiencing serious resurgences of the virus, with hospitalisations and increased mortality. We live in a very uncertain time, and we don't know when we'll get vaccines or how effective they will be, so we will have to continue societal functioning with the economy and international borders as open as it is safe to do so. I'll talk a bit about my time as CMO during COVID a little bit later on. But first, some reflections on my relationship with the ACHS. For most of my professional life, before coming to the Commonwealth, I worked in Victorian public hospitals, finishing up with an 11-year stint as the CEO of Austin Health in Melbourne. When I first came across the ACHS accreditation process, I was a nephrologist at St Vincent's about 30 years ago, and it was during the early days before the new national standards and before the advent of the highly professional survey teams and processes led by the experienced and well-trained experts you now have. Things were developing in those days, and I can recall some rather amusing exploits. On one occasion, I couldn't understand why the most dysfunctional of my medical units was given such a high rating for having clinical guidelines, when they couldn't actually agree on anything, and each of them had their own individual and policy for everything. When I challenged the surveyor, he admitted that he hadn't actually looked inside the printed protocol folders, but assumed that theirs was the best because it was the biggest and fattest. In those days, there was always a buildings and facilities person on the survey team, for some reason always on the lookout for a gotcha moment. I recall an occasion when one of these chaps marched into the new St Vincent CEO's office and announced that the body protection circuits in the operating theatre were 3 weeks overdue for their annual testing. I found out about this when a very agitated theatre manager phoned me for help, as the over-anxious CEO had called and ordered her to stop all the operations, including those on the table. I countermanded that order, not that that reaction had been contemplated by the surveyor in the first place. Fast forward to my time at Austin from 2005 to 2016, we saw the advent and maturation of national standards and the strong partnership between the Commission and the Council. We saw a very different and substantial shift in survey teams with experienced and professional leaders who could well manage team members. We saw a survey process that was incisive and got out into the business of the health service, interacting with real clinicians and critically getting a strong feel of the culture of an organisation. We saw self-assessment processes also improve greatly and a true shift to continuous improvement. Many important developments in safety and quality were driven directly by the accreditation process, such as antimicrobial stewardship, blood management, and much more meaningful consumer engagement. Accreditation to me became a sensible driver of strategic investment and a source of organisational pride when you did well. The development and continuous maturation of the clinical indicator program has also been a huge achievement, and particularly its culmination in the clinical indicator reports, the next edition of which we hope to see very soon. Nothing drives clinician behaviour better than measurement. So, as a veteran health service manager, I salute the great progress you've made as an organisation and the huge contribution to safety and quality you've made over your long and proud history. As Commonwealth CMO, pre-COVID, I had a diverse role across the Department of Health, with many intersections with the safety and quality agenda. One of my biggest interests was the National Medical Workforce Strategy. The safety and quality issues that arise from a maldistributed and unbalanced medical workforce are significant. Not just the known issues with undersupply, the significant oversupply of many medical specialties in major metropolitan cities creates its own safety and quality issues. I had a lot to do with the clinical quality registry strategy and the huge debate now about the integration of these into our slowly evolving electronic health records. We went to opt out for My Health Record, but the huge potential for My Health Record to deal with so many of the risks in healthcare will only be realised when we improve the functionality of the platform and achieve widespread and consistent use. I had a lot to do with the challenge of assurance and accreditation of private medical care, which remains a significant gap. APRA are doing great work with individual practitioners, but primary care centres are essentially still small health services with all the attendant risks. The great majority are college accredited, but it's time to move to the universal but flexible accreditation across the sector. I was thrust into some seriously challenging topics during my pre-COVID CMO time, such as dealing with the disease formerly called Lyme disease, now we call debilitating symptom complexes attributable to ticks, where potentially dangerous treatments were given by fringe practitioners, in part because the mainstream health services were unsympathetic and dismissive of people with a genuine chronic illness, albeit of unknown origin. Another challenge was dealing with the media and public campaign against the hormonal treatment of prepubescent transgender children, a significant ethical challenge, and a major outbreak of syphilis in the First Nations community, with the completely unacceptable reappearance of deaths due to congenital syphilis. And then came COVID. Last December, in discussions with Minister Hunt about me taking on the role of Health Secretary and following the retirement of Glenys Beecham, he and I both recall me saying, "Well, I'm happy doing the CMO job, it's been pretty good, and I haven't had to deal with a public health crisis, so I'm ready for a new challenge." I was tempting fate indeed. The PM and Minister Hunt asked me to stay on in the CMO role then until July to hopefully bring the COVID pandemic under control. I moved to the Secretary role in July just as the Victorian second wave was taking off, so I needed to stay engaged with COVID in a number of areas. Fortunately, with Victoria under control, I can now deal with some other issues. One that I've been working on only today is the response to the proposed recommendations by Council assisting of the Aged Care Royal Commission that the Australian Commission for Safety and Quality in Healthcare should now determine the aged care quality standards. An interesting proposition with many arguments both ways. Why have we done so well with our COVID response by international standards? I could talk for a long time about this, but just a few points are worth making. We had a good collaborative federated health protection system through the AHPPC structure and the health departments in the Commonwealth and all of the states and territories. We were also well prepared with public health laboratory network and hospital capacity. We made brave calls early, such as border closures and hotel quarantine, so that case numbers never really overcame the public health response capacity, except for a time in the Victorian second wave. We also had a flexible strategy which moved with the evidence. We did not stick to any particular ideology because this virus is new and without a rule book. Governments across Australia have consistently followed the expert health's advice. There was a new sense of national unity and a new nimbleness in our response. A good example for the benefit of Len was how we deployed AUSMAT, Australian Medical Assistance Teams locally, particularly in Victoria, and managing national quarantine. Len and Minister Hunt have become phone buddies at all hours of the day. Our health system responses presented a number of safety and quality challenges as well. We introduced universal telehealth under the MBS, a godsend for those locked at home. But there were attendant risks, particularly with phone consultations, where lots can be missed, and there is an easy avenue for unscrupulous people to set up instant access to low-quality services. We've committed to keep telemedicine going, but it has to be safe and sustainable. Lots of work to do there. Cancer screening rates fell this year, particularly breast screen, and we have to catch up. Worryingly, also during the first wave lockdown, there was a significant drop in presentations for conditions such as myocardial infarction and stroke. It's quite likely that some were actually missed. Elective surgery was cancelled for several weeks, both private and public. It's now going strong again, but again, a huge challenge to deal with the backlog. And the mental health challenges of lockdowns and unemployment have also been significant, particularly again in Victoria. And then there was the tragic consequences when the large Victorian second wave brought into aged care facilities COVID outbreaks with tragic resulting deaths. We are going to be living with this virus for many months, if not years. We have to function as well as we can whilst doing so. We mustn't compromise the high standards of safety and quality that we hold ourselves to. The vital role of the ACHS has never been more important. Thank you, and thank you again for the great honour of being your medal recipient.
Thank you, Brendan, for your signature wit, your wry sense of humour, and indeed your humility in sharing with us your thoughts as the former Chief Medical Officer of Australia and from the perspective of the many roles you've held and continue to hold. We're greatly honoured to have you join us this evening and to share with us your thoughts and reflection on what has been one of the most confronting health dilemmas we have faced in living memory. Many Australians admire your steadfastness as we went through the initial stages, and I do not think it is an exaggeration to state your calm, considered approach towards politicians and indeed handling the media on a daily, if not hourly basis, has made an impression and was strongly influential in the way in which the health efforts conducted themselves nationally and indeed on a statewide basis. Thank you again for your time, and again we are delighted to honour you with the ACHS Gold Medal. You are an inspiration. You have made and continue to make a difference. Congratulations, Brendan. I'll now hand back to Karen. Thank you.
Thank you, Len. It's also my great honour to recognise your efforts and those of the Australian Health Principal Protection Committee, AHPPC, which has had such a guiding role in the efforts this year to manage and stem the pandemic throughout Australia. ACHS wishes to recognise the committee's efforts, including yourself, and the role that it has played as a key decision-making committee for the country. Comprised of all the state and territory chief health officers and chaired by the Australian Chief Medical Officer, it has had an outstanding success in determining the measures taken to contain and control the pandemic. On behalf of all of us at ACHS, we congratulate the AHPPC and all its members for their significant role played in Australia throughout this year. This concludes our first ACHS Virtual Awards Ceremony 2020, and I do hope that you have enjoyed yourself and learnt something new as we continue to work in the quality and safety space in healthcare. Thank you and good evening.